Hello. Today's session we are going to be doing some self-massage using the Theracane. Yes, many of you have used it before. If you have one with you, please join in. We're going to be getting into a muscle called subscapularis, which is here on the front. It's a muscle that is very deep. You'll see some pictures here so you can understand where it is, and this is really the only place you can really get to it. Okay, and it's just attached to the humerus. It's where it's attached to the humerus, and it's quite a long line that it's on. That's on the arm there. Okay, we're going to be hitting a few other tissues also. We're going to hit probably be hitting the biceps a little bit, right, the long head right on the top. There's a little finger that goes along there. You see some pictures some more here again, so you understand where that is. And we will be getting into the major pectoral here. Okay, and that's more at the bottom. Okay, but we're going to have our focus on that subscapulara because it's such a hard one to get to. And then you can always go to the pecs afterwards, right? Okay, so main thing, always breathe. Nice breathe in and out. A controlled breath, not just a automated breath that we usually use. And also find yourself in a very relaxed position. You can do this on the bed, you can lay down flat, and then in that kind of nice position where the arm is up, so your pressure isn't the same, you're using gravity, and that also always helps, but in the videos this is much easier for me to just show. So we're going to be using this end of the Theracane, right? If you like, I'm going to be doing it from this end, holding here, but if you like, you can also do it here. You can work here and try it here. Okay, I'm going to be using two techniques, cross fiber fission, that's when you go across the tissue, kind of seesaw across the tissue, and also just deep pushing, kind of like a percussion somehow, but with this end. Okay, again, relax, breathe, and just try to concentrate. Let me fix this shirt a little bit. Alright, of course we have both windows for you to see. I'm here. So we're just going to begin. So that area is right there. You've seen the pictures. Okay, we're just going to go stay in that area there. Feel around there. It's very hard to hold this thing, this Theracane, right? So let's just begin. So this movement is very difficult. It's not one of the most easiest muscles to get to. All right, and holding that there and not letting it slip off. So if you're letting it slip off, don't worry, just keep on practicing. After a while, you have more control of your Theracane. Okay, so we're just seesawing back and forth, trying to make the arms kind of levered there so you don't have to use your shoulders going up. You can use the lever of your body and just make a nice seesawing up and down that little tiny area there. Your humerus. Good. As I said, it's not the easiest one to get to. So if you start feeling something like there, I feel it. So just go in there. Oh, you can feel those tissues kind of separating between each other. Oh, and breathing, making sure your shoulders down, making sure your body is relaxed. And just try that for cross fiber friction for a while. And get into that point there. Oh, that's a little bit better with my hands like that. You just have to play, okay? You can be over here if you feel better. As I say, if you like it in this position to do your massage, you can You can do it anywhere, but somehow the opening is better here, so you can really get in there. Okay, so let's go ahead and do it there a little bit. Oh yeah, that is better. It's all about hoping you can see it good for me. So I'll try to have two pictures there, showing you that two techniques I use, but always play with your own ideas. But just to understand that muscle, where that muscle is and how it can be affecting you. See what it can be doing by going across from the arm and then attaching all the way on that other end of your scapula. And how it must be affecting the rhomboids also. Because it's kind of fighting with that rhomboids on one side pulling one way and this is on the other side. Good, so now let's just kind of going up and down. Okay, I should slow down. To begin, I tend to go quite fast when I do the percussion and get into this movement. You can do it much slower, okay? You don't need to do it as fast as I am. I tend to get into that fast movement, probably because I'm nervous here in front of the camera. Okay, so now we're going to do more pushing in movements. You can push it in and try to feel where some tissue is. If it slides off and it feels weird, just let it and it's okay. You're not going to hurt yourself. Remember to use the pressure you like. You don't have to do it super hard. Even if it's not very hard, if you're working on yourself, it is going to help you and affect you. So this going, oh there we go. So this is kind of the opposite, how we had it open here. I think it's better when we're really trying to come in. We're kind of going across and down to hold that thing on the tissue without sliding off the skin. If you have oily skin, you can always put some flour there or something like that, some baby thing to take the make it a little bit more easy for the end of the Theracane to stay there. Okay, and you see how I just automatically switched. I'm trying to show you this technique. Okay, so pushing in, pushing in, pushing in. And feel around and feel those places where it might hurt. Hurt is maybe not the right word, that it just is tender and something's going on there. So actually just wants attention. It's been forgotten. I would suggest always, when you're doing these, especially at the beginning, to be in front of the mirror, because then you can see your shoulders going up or going down, and then you can just go, oh, and go like that. Okay, I can feel them, and you going down. Okay, all just helpful hints. I'm thinking that is good enough on that one. All right, it is a difficult one, the front. That energy, but there's not any other tool really you can do it with besides this. You can try to go in with your finger, but this is a very effective way with the Theracane. Okay, yeah, remember, you are your body solution master. If you like these videos, please subscribe and like and share with your friends and anybody you know have chronic pain. And if you would like to do some classes or workshops, I am around. Just check out my schedule. I'll be in Dachau for a while this year, 4 months, and then Germany. So, all right, and you just have a wonderful day. Thank you so much for watching.